let's start our discussion today with some basics of bruise. See what is bruise. This over here you can see the blackening of the skin, that is bruise. Now how it is caused? Whenever there is a blunt trauma or pressure over the skin, what I told, blunt trauma or pressure, it should not be sharp that it will cut. So whenever let's say this is an object and it is causing a blunt trauma or pressure, then these vessels will rupture. These vessels will rupture and there will be extravasation of blood over here. There will be bleeding. So that will appear as a bruise or contusion. So what is required to cause a bruise? Pressure. Now in this image you can see there are two different things. One is laceration and other is incision. See, first of all let's notice the weapon. This is iron rod over here and it is a sharp knife. Whenever sharp knife is used to cut the skin, there will be regular margins. It will cut egg properly and it will be regular margins. But if it's a blunt rod, then there will be irregular margins. This is the one difference. Second is, whenever the knife is sharp, there won't be any pressure applied. So nothing pressure is applied, only a clean cut margin is seen. But if the rod is there, then there will be pressure applied. So when pressure is applied over here, so here you can see there is a bruising. As I told you, whenever there is pressure applied, there will be rupture of vessel within inside and there will be blood coming out. So bruising is seen over here, but there is no bruising in these margins. So first difference was regular and irregular margins. Second is no bruising and bruising is seen over here. So if you here use the real life image, this is an image of incision and this is a laceration. These are the irregular margins that you can see. Now whenever a sharp object is used, let's say in this layer these are the blood vessels. Now this sharp object will cut the blood vessels. So when the blood vessels are cut, there will be a lot of bleeding. But in here this rod will not cut the blood vessel, rather than it will crush the blood vessels. So the blood vessels over here are crushed due to rod pressure, and this crushing will lead to decreased bleeding. So laceration will have decreased bleeding while incision will have more bleeding. Let's look at the diagram over here. See, this is a diagram of laceration, this is a diagram of incision, and this is a chop wound that is caused by X, that we'll learn at last. First focus on laceration and incision. See, first one I told you, in laceration there is pressure, right? So there is a bruising over here, while there is no bruising in the incision. Second is, these are the tissue bridges, the connective tissue, etc. A sharp weapon in incision will cut them, while tissue bridges are intact, because the rod will just crush them, or they will stretch and they will come back to the normal size, but will not be get cut because the weapon is not sharp. Second, floor and blood vessels. See, the blood vessels in the floor are crushed, but here they are cut. So this will have more bleeding and laceration will have less bleeding. Margins, you can see these are irregular margins, whereas these are regular clean cut margins. Now this chop wound is a mixture of incision and laceration. Now this chop wound, the X has sharp margin, as you can see. If the margin, if the X is sharp, then it will cause a regular margins. So these margins are regular, but X is also having pressure, so it will also cause surrounding bruising. So margins are regular, but there is surrounding bruising, and due to that pressure there will be crushing of floor, or the blood vessel will be crushed in this chop wound, right? So this was laceration, incision and chop wound. In this lecture we will study in detail about laceration. Incision and chop wound will be covered in the next lecture. Now what are the type of laceration? See, first laceration is incision looking laceration. Means this is a laceration, but it is looking like incision, because here you can see that the margins are clear cut regular, but when you look with a hand lens, zoom it, then you can see small irregular margin. In the naked eye it is looking regular only. So this is the difference. How it is caused? Whenever let's say this is a skull skin and this is a skull, whenever the whenever the skin is trapped between, let's say, two hard objects, this is a stone and this is a skull and this is the skin. Whenever it is trapped between two hard objects, there will be crushing of skin, and this will cause split laceration. So we have skin crushed between two hard objects. This split laceration can happen only at the skull or tibia, when there are two hard objects. One is bone and one is the outer object that you use. It should be a tough hard object. Now Next one is stretch laceration. See, for that you need to know one concept. What is a closed and open fracture? A closed fracture is a fracture in which the skin is intact. But in open fracture, the fracture is there, it will tear the skin and some parts will fall off. This is an open or compound fracture. Now what is stretch laceration? Stretch laceration is, first of all, there will be a pressure. This is pressure, and second is a pull force. So pressure plus pull force will stretch away this skin. This is stretch laceration. We need two things, what pressure and a pull force. Over here there is stretching of this skin when this bone comes out. So this compound fracture or open fracture is an example of stretch laceration. The last slide, we are studying avulsion fraction. See, this is a skin layer. Now if I apply tangential force over here, then there is a splitting or flaying of the skin layers. This occurs whenever there is a run over injuries. Let's say a tire over here runs in the skin, then there is a force like this to the skin, so there is flaying or separation of layers. So the examples are deglowing injury and scalping injury occurs in the scalp. So this was avulsion laceration. The last one is tear laceration and cut laceration. If it's a hard protruding object, it will cause tear laceration, while a semi-sharp object will cause a cut laceration. Now, final summary of incision versus laceration key differences. We know if the weapon is blunt like an iron rod, it will be laceration. Sharp object will be incision. Margins are irregular and the floor is crushed. So there is less bleeding and the tissue bridges are intact. While the tissue bridges are cut in incision, more bleeding and the floor is clean cut. Margins are regular over here.